Dorothy Cerroni is an active mother of three who has been a runner all her life. She's always kept a healthy weight and eats a balanced diet. But after feeling a lump and receiving a biopsy, she was astonished a year ago when doctors diagnosed her with stage 3 breast cancer.
I never thought breast cancer would be a problem, or cancer of any kind, because I've always eaten right and exercised, and I run a large family, and there's no history of cancer of any kind. So I really kind of ruled cancer out. I was always more worried about heart disease and diabetes, and it never entered my mind, especially I'm not a, top C or D size woman, so I really never thought, small-breasted women really ever got cancer, breast cancer.
Like many women prior to diagnosis, Cerroni had received yearly mammograms and always tested negative for breast cancer.
Don't rely on a mammogram. That's one thing I learned, and you realize how many women are affected by breast cancer, and don't rely on family history or any of the statistics, because believe me, I've met a lot of women that they didn't fit the normal image of a woman that would have breast cancer. So if you feel a lump or anything that you question, have it checked out, and if they don't give you the answer, or don't worry about it, get somebody else and get their opinion. And don't be afraid of the tests. The tests are nothing, peace of mind to know that there isn't, or that you caught it as early as you can.
Like Cerroni, breast cancer never crossed the mind of Mindy Frazer. She had a family history, but had tested negatively for the breast cancer gene. And plus, she was too young to begin receiving yearly mammograms. But in 2006, she knew something wasn't right and asked her doctor to do a breast exam.
See, when I was originally diagnosed, they thought I was too young to actually have a mammogram. And I was pretty assertive on it because of what I felt. And then there was my doctor actually did his own breast exam and thought I also should have a mammogram after that. My breast cancer did not show up. Of course, I'm a survivor. The breast cancer did not show up on the mammogram. They actually had to have an ultrasound, and that's how I found out I had breast cancer. I went through chemotherapy, radiation treatment, and surgery, of course, that all lasted approximately a year.
Genetic predisposition doesn't guarantee a diagnosis. Every woman needs to be aware of her cancer risk.
Okay, my mother did have breast cancer, and two of her sisters. Of course, you do not think that you're going to get it. You truthfully do not think you're going to get it. I actually had genetic testing done with the BRCA1 and BRCA2 genes, with the human genome, and they found that. And I did not have those genetic genes. There may be something else that they have not discovered yet, but I did not have the same type of breast cancer that my mother or her sisters had. But even though there was a history in my family of cancer, you do not think you're going to get it. You don't want to believe you're going to get it, I guess you could say.
As Frazer learned during her diagnosis, mammograms are not a silver bullet. Women need to know their own body and perform routine self-exams.
Okay. What you really have to watch, you have to do self-breast examinations. That is like one of the most important things that any woman can do. The important thing of surviving is to find the cancer early. And it usually shows up as the size of a pea, and it's not movable. Now you can have cystic breasts, which most of those cysts will be movable, but it's most important after your menses to probably about 3 or 4 days after your menstrual cycle, you should perform a breast exam. and what you're looking for, anything, any nod that would not move, you should see a doctor right away. They say that you do not have pain with breast cancer, but anyone that I've counseled, myself included, have had pain. I do not know where they say that you do not have pain, but you do have pain. But don't look at that as a symptomatic symptom of breast cancer, because it could be cyst. But the important thing is to do your own self-examination. And if you're unsure, then go see someone. That is so important, because the earlier it's found, the better off. You can definitely survive breast cancer.
As a 4-year survivor, Frazer looks at life a little differently today.
As far as how it's affected me, I've always had a love for life, and it's just emphasized it. Now, you think the average lifespan, a woman's average lifespan is 75 to 78. Now at 43 years old, you look and say, okay, you look at every day and say, what am I going to do today? What is important today?
Frazer and Cerroni have not let breast cancer define them.
Affect me today, and what changed? At the time I was going through my treatments, I was treating my father, who is also terminal, or I was helping my father, who is also terminal. I was working a full-time job, coaching, track and cross country, also volunteering, and my love for the coaching, I always wanted to go back to be actually a biology teacher. What cancer did is, my father passed away, and he said, you want to go back to school, you go back. And that's what I did, and I'm back to school. I truthfully would not have gone back to school if I didn't have a cancer, because I had a business. My business was successful, and it was in finance too. It's just, I probably would have just stayed in that job and worked it and continued with my life that way. But now I'm thrilled. Actually taking Japanese too. But now I'm thrilled. I love being at school, and I actually was voted by all the biology students at the college I'm at as the senior biology student of the year. So it's quite hysterical when I could be their mother's age. I'm their mother's age basically. But I absolutely love it. But